Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
In this edition of Health Today, we take a look at dementia, a condition that is increasingly affecting our elderly. An estimated 40 million people worldwide are suffering from dementia, and according to Dr. Ambrose Ramsey, consultant geriatrician of the Ministry of Health, the numbers in Barbados are rising.
There are probably about 4,000 persons in Barbados who are living with dementia. Now, dementia is also having a significant impact on our health system. And that is evident from the fact that between 2004 and 2005, the percentage of referrals to about 16% of the admissions to the geriatric hospital came with the diagnosis of dementia. So the referral diagnosis was dementia for 16% back in 2004-2005. Between 2008 and 2011, that average percentage increased to 32%. So the demand for long-term care by persons with dementia is increasing in Barbados.
Dr. Ramsey was speaking at a public lecture this week to debunk myths about dementia, hosted by the Barbados Alzheimer's Association. Dementia is not one specific disease, but describes a collection of symptoms that are caused by disorders affecting the brain. It affects thinking, behavior, and the ability to perform everyday tasks, particularly in people 65 years and older.
If you're within the 65 to 84 age range, roughly 5%. If you are over age 85, 50% of persons over age 85 may have some form of Alzheimer's.
Studies also show that people of African descent and West Indian origin are more likely to develop the condition. Alzheimer's is the most common form of dementia, but there are 3 other types.
There's the vascular dementia, or also termed multi-infarct dementia, and that is more common in people who have hypertension, persons who have had previous strokes, and also persons who have diabetes. Now, Alzheimer's is also more common in persons who have diabetes. Quite often, you can have a mix of these 2 types of dementia. You can have a mix of Alzheimer's and multi-infarct dementia. Now, dementia with Lewy bodies, and this type of dementia is characterized by visual hallucinations and Parkinson-type tremor. And then there's the frontotemporal dementia. In frontotemporal dementia, there are, significant personality changes, mood changes, and these individuals can become disinhibited. They tend to be more so than persons who have Alzheimer's.
The symptoms of dementia vary, but according to Dr. Ramsey, short-term memory loss, which may progress to total loss of memory, is a normal feature.
There are difficulty performing familiar tasks. So, simple things like making breakfast can become very difficult or almost impossible. There are problems with language, in that the person will have difficulty communicating, they may use inappropriate words at appropriate times. And there is disorientation to time and place, and as a result, persons tend to get lost. Okay, they lose track of the day. Eventually they lose track of the time of day.
Sufferers may also experience changes in moods or behavior, and they often exercise poor judgment, sometimes putting themselves at risk.
For example, a person may get up at 2 o'clock in the morning and open the front door, turn on the lights, and just, you may go for a walk and they just sit there. Okay? They may let strangers into the house or invite strangers, and they may also have difficulty with when it comes to managing money. Okay, they may give these individuals more money than they really should, or they may even pay. There are situations where persons have been paying workmen twice and more for jobs that are done. And as a direct result of the memory loss, the constant misplacing of things. And this is not simply misplacing keys in car keys or the house keys. This is like maybe putting like food in inappropriate places. They can put the meat in the cupboard, fresh, the frozen meat in the cupboard. And of course, over time that will deteriorate. And they may put maybe shoes. I've heard of people putting shoes in the fridge.
The geriatrician told the audience that risk factors for dementia are wide-ranging, but age is the biggest risk factor, and if there's a family history of a parent or first-degree relative suffering from dementia. The other risk factors he explained are developmental, lifestyle, cardiovascular, and psychological.
Poor nutrition being one of them. Poor nutrition, during childhood development, etc., increases the risk for dementia in later life. Low education level increases the risk. Low occupational status also increases the risk. Low physical activity certainly increases the risk. So sedentary lifestyle increases the risk for developing dementia. Low mental activity increases the risk. Smoking, right, and that's right through life. Smoking increases the risk for developing dementia, and we will have mentioned occupation earlier. Right now, the cardiovascular risk factors, specifically now cardiovascular risk factors. If you're diabetic, especially diabetes throughout life, if you develop diabetes late in life, the risk is lower, but it's still there. But diabetes throughout life increases the risk. High blood pressure in midlife, psychological risk factors. So depression increases the risk, anxiety, lack of sleep, as well as psychological distress.
At present, there's no prevention or cure for most forms of dementia. However, some medications have been found to reduce some symptoms. Dr. Ambrose advises that exercise, proper nutrition, and adequate social activity can reduce the risk of developing dementia.
To challenge your brain, okay? And that's where you do need to keep doing new things to stimulate the brain. Reading is reading new things, learning new things, having discussions, debating, arguing, word games may also be helpful. Going to new places, taking a walk in new environments, places that you haven't been before, that also is helpful. Music, playing